Can you test it real quick?
Yep, can you hear me?
Okay.
It's good?
Yeah.
Okay,
Thank you.
thank you. All right, so thank you for having me here. It's great to come and visit my downtown colleagues and tell them about a few really exciting ideas. At least they are exciting to me right now, and hopefully I will get to excite you a lot at the end of the day. So this is supposed to be, hopefully, to be a discussion, so please feel free to interrupt. What I'm going to talk to you about today are mostly novel research directions, and I'm interested to see how you feel about them and how those research directions would match your current research interest. And so what I'm going to talk about today is movement and how we can capture movement at many scales, movement that involves large and possibly permanent moves between relatively remote places, but also moves that are within cities, within much more restricted areas. And in particular here, I'm going to start off with an example that would hopefully illustrate where state-of-the-art pretty much is with respect to the spatial information related to individuals as we have now, as it comes from survey data that is currently available. And so one of the projects I'm currently working on is related to the Africa Center, which is based in South Africa. And so just to kind of point you where things are on the map, so you see Johannesburg, and then right next to the Indian Ocean you see Durban, and then a little bit north of that you see the study area where the Africa Center is. So the Africa Center has been surveilling about 90,000 people for about 10 years now. So every 6 months they try to interview people, all of them if possible, to get socio-demographic information. And then they also do HIV testing every year. And they have teams that go out in the field and try to reach those people. And they have been doing a really, really great job in summarizing GIS information, spatial information related to the locations of those individuals, right? So what you see here is a map of the Africa Center's surveillance area. And then what you see on the map plotted with really small dots are the location of the homesteads, right? So they have spatial information about every homestead in their surveillance area, and then they also have a good idea of tracking people as they move from one homestead to other homesteads, and also move out to the area either permanently or due to their to work or for many other reasons. And so what they get out of this information that they have, the spatial information that they have, and also all the testing and socio-demographic information. So what they get out of that are maps like this. And so this, the source of this particular map is a science paper that was published in 2013. So what you see there is the evolution of disease, of HIV in this area starting with 2005. So each map represents 1 year, and then you see how the HIV becomes more and more prevalent in certain zones of the surveillance area. Of course, higher prevalence is not really a bad thing. It also means that treatment works, so this means people are living longer with the disease, and also that has key implications. But the point is, this, at least as far as I'm concerned, represents the best you can do right now to go from higher spatial scale, say entire areas or country level estimates, to smaller, to estimates of small areas, and really identifying hotspots where care and efforts should be focused, right? And so what is important here is the kind of information that makes these maps relevant, and the kind of information is related to the location of the homesteads, right? So yes, please.
Well, on the issue of whether prevalence going up because of treatment or for other reasons,
right.
If they're doing annual testing, then I presume they can do the same for incidence.
So right, so they have ways to determine incidence, right? The point I'm trying to make here, and that is relevant for a lot of the work you are doing, so you are concerned quite a bit of producing country level estimates, right? And so producing country level estimates is of course relevant, but what is even more relevant is to find out hotspots where key changes occur, right? And going from entire countries to local areas, identifying hotspots, right, represents now the research direction that seems to be dominant, at least as far as I understand, right? And so, well, I mean,
well, you don't cover the whole country. And so,
of course, but methodologically, what I'm trying to say is that the kind of information that makes these maps possible, right, is the location of the homesteads. And the purpose of this talk is to make you see how relevant a map like this is, despite the fact that this is the best you can get right now. And so from what you can see and from what you know, from what I told you, why do you think a map like this is relevant at all? Given that the key spatial information here, based on which I can go from entire area to hotspots, is related to the position of homesteads. Why would science publish something like this? Any thoughts? Yeah, please, just feel free to.
Might help target interventions or figure out which areas, whether you can figure out which areas are higher risk based on their geographic factors, so like maybe roads.
So essentially what you're addressing is the point of why do I need to know where the hotspots are, right? But these hotspots, and there is no doubt that this is of importance, okay? However, the kind of information that I'm giving you is not related to people. The kind of information this is based on is the location of homesteads. And so the part that the missing part here is the connection between people and homesteads, right? In Africa, right, the circular migration is such a huge problem, right? So their way of living is for men to go out for work in the apartheid area. They couldn't, their families couldn't really accompany them, and so all the men had to live by themselves, disconnected from their families. Now, of course, there is more mobility for women and also for entire families to move. However, in this particular area in South Africa, HIV, in a sense, is still a problem because of population mobility. And so a map like this, based on the spatial location of homesteads, is only relevant if people actually exist in those locations for long enough periods of time. And so the first question is how, whether that kind of determination is actually true. Do people occupy their homesteads for long enough, or are they there for only small periods of time and then they move? Maybe they spend a lot of time out of that area. And so without us being able to quantify the link between people and their spatial locations, we cannot really look at maps like this and assess their relevance, right? Because people, yes, please.
It seems that there's something missing from this map to support your claim, which is, what are these 7 pictures? They're different.
So these are different years, right? So you start in 2006, I think, and then, so every year they did their study, right, and then they made their assessment, and then you see how from 2005 to 2006, 2007, 2008, 9, 10, 11.
January 1st, 2006?
It's for the year. It's for the year, right?
Average across the whole year?
Right. It's data they collected over a year.
So if it represents the whole year, then it's averaged over all of these seasonal migrations.
I have not given you any information about that here. The relevance is implied, but it does not necessarily hold, right? So just to show you a few more pictures, so that's how that area looks like, and I was there at the end of January, and I took those pictures, and you see that's how a school looks like, that's how a homestead looks like. And then in the picture here, you see 2 field workers I went out with, and you see how many files they carry. And the files they carried right here were files associated with people who are supposed to live in that one homestead. So they have a pile of 10 to 15 files associated with one of these homesteads. And I asked them, how can it possibly be that 10 to 15 people are actually present there? And they said, well, they are almost never there. They have this system in which when somebody goes out for work, somebody else takes their place. And so there's always somebody living in those homesteads, but the person who's actually being tested might be there only for a limited amount of time. And so after I learned the background story, I really questioned the relevance of a map like that. Because if I do not actually know where those people are and for how long do they exist in different locations, then I cannot really figure out where disease actually is, and I cannot really figure out, the processes that lead to the disease, and I cannot really figure out, okay, where do I have to target my interventions? So this is why mobility is so much important, and figuring out ways to quantify mobility, actually to observe it, is key in order to make progress in this work. And so what I try to present here are the hypothetical key locations in the life of an individual that happens to reside officially in the Africa Center surveillance area. So this person goes to work in Durban. And so for most of the year, this person is actually in Durban, and then he sends money back to his family. He cannot afford to travel more than once a month, and that's a lot to see his family. And so this person is actually exposed to environments that are a lot different than what the location of his residence indicates. And those types of environments are precisely what could contribute to him acquiring HIV and to him being able to follow up treatment if he is under ART treatment, for example. And so the location, the declared residence of this person is right here. he travels locally, right, to go to church when he's in the area. He goes to a local market. He goes to get his pills to the local health clinic. He goes to visit friends. And then occasionally maybe he goes out to a funeral not too far from where he officially resides. However, most of the time he is in Durban. And in Durban, he's trying to save as much money as possible so he can send money back to his family. And so his context, his his social context in Durban is quite different than his social context where his family is. Why? Because while in Durban he is away from his partner, he is away from his family, he is away from his friends. Being away from his family make you more prone to risky behavior, make you more prone, for example, to consume alcohol, or if you are away from your partner, as this guy is, he might be tempted to visit sex workers. And so without us having information about the key locations in the life of this individual, we cannot really quantify what his risk factors are. So we must have information that tells us what kind of environment does he live in while in Durban. Is it an environment that is rich in crime? Is it an environment that makes him exposed to bars and professional sex workers? Is it an expensive environment that makes him unable to afford health care? Maybe this is an environment in which health care is available, but this person is not aware of the existence of health clinics while in Durban because he doesn't know how to find them. So for these reasons, he might be unable to get his pills, and so his ART treatment might be discontinued because of this location. So all these key location represents part of the perceived environment this individual lives in, and this perceived environment is related to his health, determines his health. It determines his behavior. He might also choose to travel to certain locations because he seeks a particular type of behavior, right? And so based on the location of his homestead, we are really unable to get the full picture, and so we are really unable to figure out what contributes to his health and what determines his health. And so what I'm trying to make you see is that having this kind of information is really what we should be looking for. And so the way to picture this visually is that in space, this individual occupies different locations. So this axis is time, and the XY axis here are spatial locations. And then you see how over time this individual tends to have big movements and also small movements, and then he seems to be alternating back and forth between different key locations, right? And so all these key locations might represent key factors that relate to his health. However, the actual spatial location, the X and Y, are not so much relevant. What is very relevant is what could take place at those locations. And so GIS contextual information plays a key role here because this XY plane now can be decomposed into layers. And each layer could relate, for example, to the availability of healthcare. Another layer could relate to crime in that area. Another layer could relate to distance from his partner, because all these layers will be determinants of risk factors that could again contribute to his disease. And so this is the kind of picture we must be able to acquire about each individual in order to understand what contributes to his life and in order to understand what this individual is. And so I'm sure you are familiar with this UNAIDS recent report, Location, 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 which really outlines the need to go from national to subnational estimates. But then, you know, that kind of effort must be augmented by the effort to really quantify the multiple spatial contexts in which, to which each individual is exposed. Because only by knowing about those multiple spatial contexts, we can produce maps that, and understand processes that are really, really relevant, in particular to each type of life pattern. And so I will just say it again, the residential context is not sufficient. Demographic research, public health research has been focused for a long, long time on the residential context, and that the residential context is of course relevant for people with regular life patterns, but that is not at all the case in South Africa and in many other African countries, right? Because people are just move much too frequently, and for many reasons they tend to occupy spatially diverse locations. And then figuring out the spatial collocation of individuals is also important, because if you want to think about sexual networks, right, then sexual networks are really dynamic in space, right? Because individuals move all the time, and so by knowing spatial, by being aware of spatial collocation, you can quantify better the evolution of the spatial network, and so you can quantify better how disease can progress, progress in the population. So what kind of data will make us able to look at all these multiple spatial contexts that characterize an individual? Well, geolocation data that records, tracks people through long periods of time has an incredible relevance here. And now technologically, we're able to actually collect that kind of information, right? GPS, right? So one way to collect this information is through GPS trackers. GPS trackers are small devices that are dedicated to recording GPS locations. These are the kind of devices that are used in physical activity studies focused, for example, on obesity, right? But these kind of devices are basically useless for the person who is wearing them. And for that reason, asking a person to wear a device such a device is not necessarily going to be possible over longer periods of time. So studies that are limited to 1, 2 weeks, maybe 1 month are possible, but after that, that individual is unlikely to carry that device anymore. And so cell phones become key here, because cell phones as technology do not carry any social stigma, quite the opposite. A person having a cell phone is well seen, and then cell phones are able to record geolocation. So, and then, you know, as we know, the cell phone companies actually record our day-to-day life, right? So just to give you an example, I received this email from Bill King, who is an employee of AirSage. I would invite you to check out this website, airsage.com. So AirSage is a company that sells cell phone data. So they have a network within the network of all the major US carriers. And so our cell phone records, right, our GPS tracking signals, if you are a subscriber to AT&T or Verizon or Sprint or T-Mobile, will be in these guys' databases. And so what they do is they pack the data, and then they are able to sell that data to clients, and all this data represents the location information of millions of people. And this is a demo they put together to illustrate the power their data has, and so they try to look at the mobility of people related to a sporting event, right? And so they have an animation here showing how people moved, and so in time, and so you see the red areas represent higher concentration of people, and then you see how people move over time. And so this is data that is being tracking data, GPS tracking data that is recorded on a regular basis by cell phone companies. And essentially all the data you guys allow them to have by just carrying your cell phone with you is what goes into those databases, and then you see how people can be really be tracked, right? But this kind of geolocated data can only be used at an ecological level, because AirSage is not going to know more than location information. Everything else about you, right, is not going to go, hopefully, into those databases. But the point is here that technologically we're able to track millions, maybe billions of people over time. And so with that kind of technological advances, we can now construct and study multiple spatial contexts associated with millions of individuals. And so residential location, in my opinion, should be replaced with personal activity maps. So these maps should pretty much encompass the relevant areas in which a person is active. You should identify what takes place, what kind of activities can take place in each of these areas. And so based on this information, then we can go and measure mobility. We can measure the extent to which, at the times at which you occupied different locations in space. And then from there, you can determine associations between what takes place in each of those areas through GIS contextual measures, and further make the link to health. And so to me, that seems to be an area of research that has tremendous values. And then again, technologically, we can actually do all that. So that could open up the possibility of new types of studies being done. And that opens up the possibility, well, I'm a statistician, so I develop methodology, that open up the possibility of many new spatial models that must be developed to represent such complex type of information. And so, so these are three types of GPS individual level data. So first of all, right, the first and most detailed data would come from personal devices. So these personal devices will be worn with the consent of the people in the study. However, there's the second type of data that relates to tracking information that is recorded on 30-second basis by the cell phone companies, right? So this is where that animation I showed you before comes from. And so that kind of information is being collected really without our consent. We do not have any control over it, but it exists. And so I will be showing you examples of how that kind of data coming from Rwanda can be used to understand mobility patterns. And then the identified level of, cell phone records lead to this, to ecological type inference, and that kind of inference is really, really powerful because of the sample size. Right? Yes, please.
What is the frequency of records for the individual cell phone records? Are you looking at like once a day or once every couple hours? Because imagine like if you're going to work or
So that is a very good question. So there are actually two different types of spatial information that is being stored, as far as I know, by cell phone companies. One type of information are called call detail records. So every time you make a call or you do something with your phone that relates to billing, they are going to create a record, right? Because they need to know how to bill you. And so every time you do something with your phone, you are going to create such a record that will disclose your location. There is a second type of information that comes from ping being given to your cell phones at 30 seconds, every 30 seconds. So every 30 seconds, you know, the network of towers will attempt to determine where your cell phone is. And they also save that kind of information, and really that is the information they might not even want to talk about. But I know of companies who have obtained data from AirSage, actually here in downtown Seattle. I can disclose that, and they are using it, and essentially it's our own information, right? Yes, please.
I'm wondering about the trade-off, how trade-off is balanced between anonymity and usefulness of this information in terms of what you're talking about for HIV purposes.
Yeah. Right. So yeah.
Sorry, as an example, right? If on the plot you were showing, right, a single dot can be traced from place to place, then it doesn't matter that you don't give me your name, because you know if you look at my dot, you know that I live in Capitol Hill and I work here because that's where I go every day. If that dot is traceable.
Right.
However, if you can get a time series of a single individual, you then also lose a lot of information because you can see that individual pixels are in one place and then are in another place at given points in time. But you can't say that somebody went from a rural, that a single individual went from a rural area in Africa Center to a bar in Durban.
Right.
So I'm wondering how
I mean,
you achieve that.
that very much depends on how you obtain that information. Okay, so if you obtain location information through consent, then you are going to carry a device, maybe a cell phone, that will record that type of information. And so ideally, that is the kind of information you would want to have, location information obtained through consent, right? The location information that is being stored anyways by cell phone companies exists. So those databases are there. Companies are trying to sell that information and to prove its usefulness, right? And so that kind of information has really less relevance for health research. It is important because it exists. It would be nice if we could look at them. I tried to connect call detail records with DHS data. And if I get to that, I will show you how something like that looks like, and really the difficulties that are involved in such an approach. After trying it, I'm a little bit turned off from, for many reasons, by following that path. And the first reason relates to the fact that those individuals never consented to be part of such a study, right? However, the fact that you can actually look at the mobility of millions of people is just fascinating, because it could also uncover events that were unplanned. So if you would know, for example, if you are doing disaster research, right? You don't know when a hurricane will strike, right? And so what we would like to do is figure out, in order to figure out the impact of a disaster type of event, of a hurricane on the life of people, you would like to follow the impacted area before the event to establish a baseline, and then see the kind of mobility that exists in that area, and then go back to see, where people moved while the event was taking place, and then to see whether the regular life patterns have resumed after 1 month or maybe more post-event, right? So since you do not know when an event like that would take place, then it is very, very hard to define a study, right? And so this is where collective cell phone records can play a huge role, simply because they exist all the time. And so for health, they have tremendous values. But in terms of preserving individuals' anonymity from detailed cell phone records, that is a problem. Because most likely than not, from such information, you will be able to learn about your home location, about your work location, and all those key locations in your life, and that will most likely identify you, right? And so, are there any other questions? Yes, please.
Well, I guess there's another issue with obtaining consent to, for instance, for people to be wearing these individual.
That is a study with consent. So
yes.
Right.
Even so, though, for health reasons, that may be the preferred option. There would still be two issues. One is that the people who refuse may be very different from the ones that agree.
Correct.
In all sorts of types of behaviors that
Right.
you're interested in. And two, just the fact that you ask people to wear that might alter behavior as well.
And so that is absolutely true. But I heard talks from people who are doing GPS studies for physical activity, obesity research. And most of these studies last for 2 weeks. I know of one out of Chicago that lasts for 1 month. So they claim they have 30 consecutive days of GPS tracking for the individuals in their studies, right? So their explanation for observing people for about 2 weeks, maybe a month, is that people will alter their regular life patterns for a couple of days at most. And after at most a week, you will go back to do whatever it is that you were doing. And so it would be very, very hard for somebody to alter their life patterns for a year in a really, really significant way. Of course, they can turn off their GPS tracking devices, their cell phone at any time. And so, they must be able to do that. However, it will be clear if you look at GIS contextual information, the relative vicinity where they move. And so not observing particular locations with accuracy is not going to have a major impact, because overall, if you look at over long periods of time, you will be able to understand pretty much where they choose to be and where they have to be, right? And so if you have them wear a device such as a cell phone, which they like to carry, then looking at their life patterns for 1 year is no longer a problem. At least that's how I see it. And so what I have here are a couple of examples, so a couple of people who were part of a GPS tracking study here in Seattle. And so this is just an example to show you that, you can really see where their life actually takes place over 2 weeks. And then you see each day of the week, so the 5 working days and then the weekend, how their trajectories change. You can really figure out key locations such as their home and workplace, and so you will know what kind of mobility and contextual effects they are exposed to by looking at their GPS traces. And then, if we move from individual to individual, then we see how their life patterns tends to change. And so for example, this person right here, during weekends, he doesn't seem to be doing much, right? So, he just doesn't want to do much, and then as the week starts, he just doesn't go too far either. Yes, please.
One thing is where you are, and another thing is how you get there. This guy in the left corner, he may have done a lot by car. So in a physical activity, maybe that guy was in the treadmill, did more than this guy.
Absolutely. So there is a lot from the GPS tracking information which is not represented in the map. So these maps are just supposed to show you that you can identify spatial scale and you can identify key locations. Of course, the activity types are not represented on this map, but it is possible if you have dense enough information to determine, say, activity levels quite easily, right? So right, but the point is, you made a very good point that just says GPS tracking information is so rich. There are so many ways and so many things you can do with it, and then there are so many ways in which you could create useful variables which could be used to understand the systems those individuals are involved in, right? And so it seems, something kind of pretty much trivial to observe time and location, but then there are the array of useful knowledge you can extract out of this, especially if you also couple that with GS layers, is really infinite as far as I see right now. And so you can look at overlapping spatial patterns, right? So for example, you can look where and when those 4 individuals coexist in space. And so quite a lot of the research that I'm doing now relates to mobility measures. So quantifying the spatial extent of movements based on GPS tracking data. And so these are a couple of measures which I'm looking at. We will come back, if we have time, a little bit later to explain them. The point is that through mobility measures, you can now quantify how mobile an individual is. And each of these mobility measures are designed to capture overlapping, but also different key dimensions of mobility. So all these 6 measures here will capture another aspect of mobility, and the idea here is that one individual could be more mobile with respect to one measure, but less mobile with respect to a different measure. Of course, individual 4, the person who just doesn't move during weekends at all, right? We looked at it together. Well, pretty much all the mobility measures are going to agree that this guy doesn't move, right? But then for highly mobile individuals, then looking at different dimensions of mobility becomes important, right? So that because the life patterns are really, really different. And then looking at mobility patterns according to times of day, days of week is also relevant. And then you see here that person number 4 really doesn't move at all. And then person number 3 happens to be the twin. Person number 4 is actually the highest mobile from all those 4 individuals. And all the mobility measures seem to agree with that for the weekend. And so, so putting everything, having those mobility measures is very, very important, because then you can essentially embed different aspects of GPS tracking data in statistical model. So now, coming back to the bigger picture, GPS tracking information is very rich. This is true big data, both in terms of dimensionality and in terms of diversity, because once you start adding GIS layers, right? And so a lot of literature, right, is dedicated to looking at migration. But nowadays, migration, which represent permanent moves, are really less important, because people tend to move a lot more than they used to. Because right now it's so much cheaper to travel. Travel is really accessible even to the poorest individuals. And so looking at migration patterns, in a sense, is not the key question. At least that's not as far as I can see. Looking at mobility patterns, which captures different types of moving, both local, long-term, short-term, different spatial scales, is really the key question. And capturing mobility is, at least in my opinion, what we should be concerned with. And so by looking at mobility, we are able to look at the spread of infectious diseases, right? We are able to look at health behaviors, and then all types of dimensions of individuals' well-being. So in the past, right, mobility information has been collected through surveys, right? And so in the past, there was, there were certain questions in those surveys that ask you, how long have you been present at your current residence? Where have you traveled in the past year? And so all those questions could only capture a very limited array of movement. And all those questions really were based on the individual's ability to remember what they have done. So clearly, they are going to remember larger movements, in a given period of time. But shorter and maybe more frequent movement might not be captured in such surveys, and then those individuals might just fail to report every key locations altogether, right? Of course, for the same reason, somebody might stop wearing the GPS tracking device, right? But then again, the advantage that we have by having relatively dense spatial locations is the fact that we are going to have a rough idea where that individual was. And so in that sense, call detail records, right, become really, really important. And so at an ecological level, call detail records is, if available, can be used to supplement census and survey information related to movement. The key aspect here is that CDRs capture unplanned events, right? Because those databases are collected all the time. But then their major drawback relates to how representative for the population CDRs are. So pretty much everybody right now, even in the poorest countries, tend to have a cell phone. However, their pattern of cell phone usage can be quite different, depending on their wealth, for example. Because some individuals might avoid to make calls altogether, and then if that is the case, then they will get very, very few CDRs in those big databases. And so part of the research that I'm doing relates to identifying where an individual might have been based on the locations that I got to observe. So part of this research relates to essentially capturing the holes that exist in cold ether records because of individuals essentially not being active on their cell phones. And so based on that kind of information, we can not only attempt to get better results to all questions, but also we are now able to answer new questions altogether, because we are now able to capture spatial context in all their complexity. And so, for example, measuring distance to your partner on an everyday basis becomes, and at every time of the day becomes possible. And so with that kind of variable, distance to your partner, that could be indicative of your likelihood of exhibiting risky sexual behavior, for example, right? And so that kind of measurements really was not available before detailed location information was available. And so I think I will have to end in a couple of minutes, but I will just I'll just show you this. So this is a data set that comes from Rwanda. It spans several years, and I have location information about 1 million people per year. And so this is a very rich data set. Is relatively old. However, it is quite relevant and quite intriguing. And so what I know are the times, the duration, and the location of the phone calls made by all the individuals in a major wireless provider. And so since I do not know anything else about those individuals, what I try to do is connect temporally and spatially the GPS tracking information that I have with DHS data, right? And then I chose DHSs that have location information and also for which HIV information is available. And so once I plotted all the locations that I have in Rwanda, then the map that I obtained looks something like this. And so yes, this is a mess. Yes, it is unclear what is going on. Why? Well, so what you see on this map with different colors are the locations of the DHS clusters corresponding with the different times, the DHSs were administered, 2010, 2007, 2005, and also in red the locations of the cell phone towers, right? So those are, so that represents the location information that I have in my data. And so trying to combine all these point-wise locations is challenging simply because, well, mapping everything to known geographic boundaries is really not relevant, because the processes that are captured at each of those locations are not necessarily represented by the boundaries of the different parts of Rwanda, right? And then we can, if we if we segment the data that way, we run into the modifiable areal unit problem. And we could essentially be missing key hotspots by segmenting the spatial information that we have. And so from a temporal, from a longitudinal perspective, but also from the perspective of combining cold ether records with DHSs, the challenges are quite significant. And from a methodological perspective, this is a problem that has yet to be solved. And so I will, I think, have to stop here. But then I'm happy to take any other questions you might have. Okay, thank you so much. Thank you.